Now, I'm hoping that everything I'm going to talk about in my 6 minutes, you already know about, because I'm hoping you're already accessing it. But if not, then hopefully you'll be pleased to hear some of this. So I googled up a maze because I think the lymphedema world is a bit of a maze of accessing treatment and working out what am I entitled to in both the public and the private setting. So how do I first of all find a qualified lymphedema practitioner? Probably even before that, how do I get a diagnosis of lymphedema? Do I seek management in the public or the private setting, and how do I do that? What are the waiting times? What are the costs? How much do I get back? How much do those garments cost? And what are the options? So the ALA, the Australasian Lymphology Association, has a National Lymphedema Practitioners Register that has a register of qualified lymphedema therapists that we know and we can guarantee to you have completed formal training in lymphedema management and can treat you by best practice management. So you can look up on their website, you go to this little button, find a practitioner, you can put in your postcode or where you live, and it will come up with a list of therapists who work in your area so many kilometres away. Okay, and so there it is, you put in where you live and you'll be able to find someone, and that's in Australia and New Zealand. I think we only need Australia here. When we talk about public or private, we've heard already that the public services are very limited. And really, we encourage you to try to access services through the public system. However, the challenges are that their resources are limited for the number of people living with this condition. And I know when I used to work at Westmead Hospital, we set up this great clinic, and we used to get 200 new referrals a year. And after 20 years, they still had the same staffing that we did 20 years earlier, with 200 new patients, and everyone still stays who has this chronic lymphedema. So it's not the clinic's fault, it's the management about how to resource such a service. So there are often waiting times, and depending on how a public service is funded will depend on who they might give priority to. So we, again, like Helen said, we need to be lobbying our local members because they need to know where the problems or the gaps are. Now, what are the costs of treatment? So if you go to a public lymphedema clinic in a large teaching hospital, then there's no cost to you for the actual treatment because it's publicly funded through Medicare. There may be some out-of-pocket costs for compression garments, but we'll talk about garments in a minute. Now, with the private setting, there are generally out-of-pocket expenses, but there are two ways that you can access rebates by going through the private setting. So there's a Medicare option and a private insurance option. So who's heard of this system? The Chronic Disease Management Program. It used to be EPC, now it's called CDM. Who's heard of this program? Okay, good. If you are seeing a private lymphedema therapist and you have lymphedema, you can go and talk to your GP about getting a referral to see a qualified lymphedema therapist through this chronic disease management program. So your GP is in control of preparing the paperwork. And I've heard in the past some GPs say, oh, don't worry about it, it's a lot of paperwork, but it's better in your pocket than in the government's. So I'd encourage you and urge you to do it. Okay, so it does entitle you to receive 5 sessions with a lymphedema therapist, or in fact other allied health. So the doctor and you work out the plan of who's part of your team, and you usually have an out-of-pocket expense. So the Medicare rebate is about $53 per visit. That fee, that rebate hasn't changed since 2013, but you're getting something back. Okay. Now, private health insurance, that's another maze of its own. And, you know, when I Googled private health funds, there are some of the logos and that for all the different health funds. Now, every single private health fund is different. So when you ask your health practitioner, your lymphedema therapist, you know, what should I do? It is dependent on your private health fund and what level of cover you have and what you're entitled to for that level of cover. However, I would suggest that if you've been with your health fund for a long time, as in maybe all of your life or for a very long time, and you're only getting a small component of rebate from your private insurer, you could actually be in a negotiation with the, go and speak to not the first person at the desk, but their manager, to talk about whether you can negotiate that you maybe don't need, chiropractic services or podiatry services, but you'd like to get all of your ancillary cover through lymphedema management. And I've had many patients who have had that conversation, and because they've been a member for 20 or 30 years, have actually gained some rebates for lymphedema management. That being both the consultation with their therapist and also potentially rebates with compression garments or other items associated with lymphedema treatment, like for example compression pumps or other self-management techniques. So I often say to my patients, you often get more back from your private health fund for your first consultation, because the therapist will write it's an initial consultation, and the health fund often have a code specifically for initial consultations, and then they have a code for follow-up consultations. So you've got to work out which system's going to work best for you. So you might get your initial consultation through the private health fund, then go and have 5 consultations to get the Medicare rebate, and then go back to your health fund for follow-up if you need extended more visits. It is a maze. And then the last thing I want to talk about, my 30 seconds, is Enable New South Wales. Who has heard about Enable New South Wales for funding of compression garments? Okay, good. Who pays for their own garments and gets money back from their private health funds? Okay, who gets a combination of both? No, okay. So this may interest those, particularly if you're not familiar with Enable New South Wales. So Enable New South Wales provides equipment and services to people with chronic health conditions. Lymphedema is a chronic health condition, so you may be able to access some support through this fund. You need to be working with your lymphedema therapist, and it's a bureaucratic system. It's the bane of my life and our other therapists, but it works and it's your benefit to apply for it. Okay? So initially, you look on the Enable New South Wales website, which is up there, or just Google Enable New South Wales and how to apply. Applying to Enable. So you can apply online, or you can download the form and write it in or type it in. It's got all of the options for you. Then you discuss with your therapist what are your needs regarding compression therapy, and your therapist will assess you. They will get a quote for the garments that you need, and we have to complete an assessment of what your needs are. The 3 pieces of paper go in together to Enable, or Enable find them together, and then they assess your application. So there are 3 levels of assessment, category 1, 2 and 3. But if you get approved, it is a means tested system, but even if you're in the highest level, band 3, you will still get something back through Enable towards the cost of your garments. Okay, so if you're on a pension, you're often category 1, and you get 2 sets of garments every 6 months, and you pay $100 co-payment per year. If you're in category 3, then you get 2 sets of garments every 6 months, and you often have to pay 20% of the cost of the garments. But it's still much better saving it in your pocket and plan to go on holidays rather than spending the whole amount on your garments. So they're just a few tips, and hopefully I'd encourage you, and if your therapist say, oh, Enable, it's too much paperwork, say, no, I really want to go through this system.
Thank you, Louise.